afternoon. My name is Andrew Henderson, and I'm a captain with the Hollister Fire Department. Today I would like to talk to you about community risk reduction. Community risk reduction is a proactive approach to addressing and reducing the risk of negative outcomes in a community. It is a collaborative effort that engages all members of the community in identifying and addressing factors that contribute to risk. Community risk reduction is an evidence-based approach that is informed by research and data. It is a comprehensive long-term strategy that recognizes the interconnectedness of risk factors and the need for solutions. Community risk reduction is an effective tool for organizational growth and efficiency for several reasons. First, it helps organizations to identify and address risk factors before they lead into negative outcomes. The proactive approach can save organizations time, money, and resources that would otherwise be spent responding to crisis. Second, community risk reduction fosters collaborations and partnerships between organizations, agencies, and individuals. These partnerships are essential for developing comprehensive solutions to complex problems. Third, community risk reduction is an effective way to engage community members in identifying and addressing risk. Community members can have unique knowledge about the factors that contribute to risk within their communities and are essential partners in developing solutions. Finally, community risk reduction is a long-term strategy that recognizes the need for continued investment in order to make sustained progress in reducing risk. Community risk reduction plans are designed to identify and mitigate risk within communities. To do this, a variety of data is used to identify potential risks and hazards. The data can be divided into three main categories. Demographic data. The data includes information on the population of a community, such as age, gender, ethnicity, and income level. This data can be used to identify risk factors that are specific to certain groups of people. For example, if a community has a high percentage of elderly residents, this may indicate a greater need for service and resources that cater to that population. Geographical data. The data includes information on locations and community as well as climate and topography. This data can be used to identify potential risks that are specific to certain areas. For example, if a community is located in a flood zone, this may indicate a greater need for resources and services that can mitigate the risk of flooding. Historical data. This data includes information of past events that occurred in the community. This data can be used to identify trends and patterns that may help predict future risks. For example, if a community has a history of wildfires, this may indicate a greater need for resources, services to mitigate the risk of wildfires. With that said, the opioid epidemic, has had a profound impact on emergency service delivery, not only for the United States, but our city as well. The rise in heroin and prescription drug abuse has led to an increase in overdose calls that tax already stretched resources. In addition to the stigma associated with addiction, often prevents people from seeking help, which lead to more serious health complications and even death. The initial response to most overdose calls are the fire department, police officers, and medic units. These individuals have all been trained in how to deal with someone who is high on opioids. As a result, they all now know how to administer naloxone, which is an antidote that reverses the effects of an overdose. The stigma surrounding addiction is also a major barrier to care. Many people are afraid to seek help for fear of judgment or rejection. This is especially true for people who inject drugs. or who use injectable drugs, as they may feel like they're being treated like criminals. This stigma can prevent people from getting the care they need, which can ultimately lead to more overdoses and more deaths. The cost of opiate addiction is staggering. Every year, addiction costs the organization and the community hundreds of thousands of dollars in human, social, and economic costs. The human cost of opiate addiction is immeasurable. Every year, a countless number of people die from overdose, and countless more suffer from the effects of addiction. Addiction is a disease that destroys families and communities. It tears apart families and friends and leaves a wake of death and destruction in its path. The social cost of opiate addiction is also staggering. Addiction leads to crime, violence, and poverty. It destroys communities and ruins lives. Every year, addiction costs the community hundreds of thousands of dollars in homelessness, increased crime, and increased healthcare costs. Opioid addiction is a disease destroying families and communities. It is a drain on our resources, and it takes toll on our economy. We must do something to address the problem. The first step in the community risk reduction is to identify this risk. Risk factors for opiate addiction include things like poverty, unemployment, lack of access to healthcare, and social isolation. Once these risks have been identified, community risk reduction mitigation strategies can be applied. Poverty is a risk factor of addiction. To mitigate this risk, community members can work to increase access to resources like food, shelter, and clothing. They can also work on creating jobs and job training programs. Lack of access to healthcare is a risk factor as well. To mitigate this risk, community members can connect people with resources like free or low-cost healthcare. They can also work to increase access to mental health services. Social isolation is a major risk for opiate addiction. To mitigate this risk, community members can work to connect people with social resources like support groups and recreation programs. In 2020, we had 63 overdoses, so we started outfitting and teaching police officers how to use Narcan, which is naloxone, as I stated earlier. And now, in 2021, we have dropped to only 28 overdoses. Our goal moving forward is to start teaching families of users and to get Narcan for them so they can help their family members if they find them in need. The cost will be $30,000 to get Narcan and to set up trainings at farmer markets, open houses, and community trainings. This will cover the cost of advertising, the initial cost of the Narcan, and the personnel hours for the trainings. Thank you for your time and the opportunity to speak here today.